Welcome to ICU Primary Prepcast.
Hi, I'm Maddi.
Hi, I'm Swapnil, and this is another primary snippet for this week. So, Maddi, before we dive into today's topic, how's your week been?
It's been good. My sister had her baby, which was great in New York. So I've got a nephew now who's now almost a week old.
Oh, well done. Congratulations.
Thank you.
So let's dive into today's snippet. So, Maddi, can you please outline the physiological factors that affect PaCO2?
Well, so PaCO2, importantly, first we need a definition, is the partial pressure of the CO2 in arterial blood. So this is normally 35 to 45 millimeters of mercury. And PaCO2 approximates the VCO2, which is the CO2 production by the body, divided by the VA, which is the alveolar ventilation. So this is equal to the VCO2 times about 0.863 divided by alveolar ventilation, which then is equal to VCO2 times 0.863 divided by the eliminated CO2 or the minute ventilation minus the dead space ventilation. So using that equation, we can see that the factors affecting PaCO2 are those related to CO2 production, so the CO2 production by the body, and those related to CO2 elimination. Generally, the PaCO2 is tightly controlled so that any increased production will cause an increase in ventilation and therefore an increase in elimination. But we can think then about the physiological factors that affect PaCO2 in terms of the factors related to production and the factors related to elimination or alveolar ventilation. Starting with the factors related to production, CO2 is produced through mitochondrial aerobic metabolism via the Krebs cycle, and this is influenced by the metabolic rate and the metabolic substrate used. So anything that increases the metabolic rate will increase CO2 production. So this is things like increased temperature, exercise, pregnancy, increased muscle mass if you're males or if you're neonate, as well as pathological kind of states like hypothyroidism or malignant hypothermia. But at the moment, we're just talking about physiological factors. The second thing that can affect factors related to CO2 production are the metabolic substrate use. So we think about something called the respiratory quotient, which is the ratio of the CO2 produced to the O2 consumed. So respiratory quotient of carbohydrates is 1, the respiratory quotient of protein is 0.8, and the respiratory quotient of fats is 0.7. So therefore, if there's an increased proportion of energy derived from fat, this will decrease the CO2 production for every oxygen molecule consumed. So you might sometimes see for people with like severe COPD who are ventilated, we sometimes talk about maybe reducing the carbohydrate load. Then coming to the factors related to elimination or to alveolar ventilation, we can think about the control of alveolar ventilation and dead space. So in terms of the control of alveolar ventilation, there are chemoreceptors, which are both peripheral and central. So the peripheral ones are located in the aortic and carotid bodies, and they detect a decrease in PaO2, which causes an increase in respiratory rate and tidal volume, which increases minute ventilation and therefore increases CO2 elimination. They also detect an increase in PaCO2, and this causes a synergistic response or more of a response if the patient is also hypoxic. They also detect increased hydrogen ions, so acidosis, and a decreased pH, and this also increases minute ventilation. The central chemoreceptors are in the medulla, and they detect a decreased pH of CSF, and they're very sensitive to this. So the CO2 diffuses across the blood-brain barrier from the arterial blood into the CSF. They react with water to cause H2CO3, which decreases the pH and increases minute ventilation, therefore clearing CO2. Other causes of increased minute ventilation include things like exercise, which causes activation of stretch receptors and stimulates the respiratory centers and increases the respiratory rate. Pregnancy due to an increased progesterone, and the increased progesterone also decreases the carbon dioxide response threshold of the respiratory center and increases tidal volume. Things like pain, anxiety, or fear increases autonomic inputs, which involves respiratory motor neurons, which increase respiratory rate. And hypotension causes activation of high-pressure baroreceptors, which then increase the respiratory rate. The second big factor is dead space. So increased dead space decreases alveolar ventilation. However, this is mainly a pathological process, not physiological factor. because anatomical dead space is reasonably constant. But if we were talking about pathological factors that also control or affect PaCO2, anything that increases your dead space can also increase your PaCO2.
So thanks, Maddi. That's the end of our today's snippet. We'll be back in week's time with another snippet. Till then, goodbye and have a nice time.
Thanks for listening. See you next time.